Are you keeping a close eye on your kidney health? You know, it's a common fear. You get a lab report back, see a concerning creatinine number, and immediately think kidney damage. But what if that's not always the case? The truth is, some everyday medications could be the secret reason behind those skewed results. Creatinine levels are, of course, key indicators of kidney health, yet many of us underestimate the role certain drugs can play. Some medications and even pharmaceutical additives can artificially elevate your creatinine without actually harming your kidneys. So, in this discussion, we're going to explore the top 6 hidden drug ingredients that can alter your test results, offering some really crucial insights for both patients and healthcare professionals. Number 1, cimetidine. All right, kicking things off with number 1, we have cimetidine. You might know cimetidine as an H2 blocker, a medication often used to treat acid reflux and heartburn. Well, it's also a well-known agent that can cause an increase in serum creatinine levels. Now, it's important to understand this effect isn't due to any kidney damage. Instead, it stems from cimetidine's ability to inhibit the secretion of creatinine in the renal tubules. These renal tubules are tiny tubes in your kidneys that help filter waste products from the blood. Normally, creatinine is filtered by the glomeruli and also actively secreted by these tubules. So, when cimetidine blocks this tubular secretion pathway, less creatinine is cleared from the blood. This leads to its accumulation and, you guessed it, a higher reading in blood tests. In fact, studies have shown that cimetidine can raise serum creatinine levels by as much as 15%, even in individuals who have perfectly normal kidney function. This elevation is typically seen shortly after starting the medication, and thankfully, it's reversible once cimetidine is discontinued. In clinical practice, even though cimetidine use is less common now with the advent of proton pump inhibitors, healthcare providers should still remain aware of this potential interaction. It's really important to distinguish this benign effect from true kidney impairment, which would, of course, require further investigation and management. Misinterpreting this rise as kidney damage could lead to unnecessary anxiety for the patient and potentially inappropriate medical interventions. That's why a thorough medication review is absolutely essential whenever an unexpected increase in creatinine is noted. Now, while cimetidine's impact is certainly noteworthy, another commonly prescribed medication, this time an antibiotic, also has a knack for masking true kidney function. So, let's delve into how trimethoprim can lead to similar concerns. Number 2, trimethoprim. Coming in trimethoprim. Trimethoprim is an antibiotic that's commonly prescribed to treat a variety of bacterial infections, and urinary tract infections are one of its most frequent uses. Much like cimetidine, trimethoprim can lead to an elevation in serum creatinine levels without causing actual damage to the kidneys. The mechanism here involves competition at the kidney's proximal tubules. You see, these proximal tubules are responsible for actively secreting creatinine from the blood into the urine. Trimethoprim competes with creatinine for the very same organic cation transporters in these tubules. So, when trimethoprim is present, it effectively reduces the amount of creatinine that can be secreted. This causes creatinine to be retained in the bloodstream, leading to a higher measured serum creatinine level. This effect is dose-dependent, and, good news again, it's typically reversible once the antibiotic is discontinued. Now, given how widely trimethoprim is used, especially for common infections like UTIs, there's a significant risk of misinterpreting kidney function in patients taking this medication. An elevated creatinine level in someone on trimethoprim might be mistakenly attributed to worsening kidney disease or even acute kidney injury. And this could lead to unnecessary diagnostic procedures, changes in other essential medications, or just undue alarm for the patient. So, healthcare professionals really need to consider trimethoprim as a potential cause for isolated creatinine elevations, particularly when other markers of kidney function remain stable. Understanding these antibiotic effects is certainly crucial, but what about medications used for inflammation? Well, next up, we're going to explore how certain corticosteroids can present a different kind of challenge when it comes to interpreting creatinine levels. Number 3, corticosteroids, e.g. dexamethasone. All right, let's talk about corticosteroids, for example, dexamethasone. Corticosteroids like dexamethasone are powerful anti-inflammatory and immunosuppressant drugs. They're used to treat a wide range of conditions, think asthma, arthritis, and allergic reactions. Now, while corticosteroids themselves don't typically affect creatinine secretion or production in a way that mimics kidney disease, certain formulations, particularly intravenous or IV ones, can sometimes lead to what we call spurious elevations in creatinine levels. Interestingly, this is often not due to the active drug itself, but rather due to excipients present in the IV formulation. What are excipients? Well, they're inactive substances added to medication formulations to help with things like stability, delivery, or manufacturing. In some reported cases, specific excipients in intravenous dexamethasone preparations have been implicated in causing abrupt and reversible rises in serum creatinine. This type of interference can cause significant confusion because it might suggest acute kidney injury. This is especially true in critically ill patients who are more likely to receive IV corticosteroids and undergo frequent lab monitoring. The key thing to remember here is that the elevation is often transient and resolves once the medication is stopped or the formulation is changed. It really underscores the importance of carefully interpreting laboratory results within the context of a patient's full medication list, including the specific formulations of drugs being administered. For clinicians, being aware of such potential interferences, especially with IV corticosteroids like dexamethasone, is absolutely vital to avoid misdiagnosis and ensure appropriate patient management. Distinguishing these spurious elevations from genuine kidney damage requires a really comprehensive clinical assessment. So, moving on from anti-inflammatory drugs, it's quite interesting to see how a medication aimed at managing cholesterol can also muddy the waters of kidney function tests, though it does so through a completely different mechanism. Let's take a look at fenofibrate next. Number 4, fenofibrate. Our fourth hidden ingredient is fenofibrate. Fenofibrate is a medication that belongs to the fibrate class. It's primarily used to lower high cholesterol and triglyceride levels in the blood, which in turn helps reduce the risk of cardiovascular disease. Now, unlike some other drugs that interfere with creatinine secretion or how it's measured in lab tests, fenofibrate has a different mechanism that can lead to increased serum creatinine levels. It actually appears to increase the production of creatinine in the body. As a quick reminder, creatinine is a waste product derived from creatine, which is a compound involved in energy production in our muscles. Fenofibrate is thought to affect muscle metabolism or creatine turnover in such a way that it results in a higher output of creatinine. This means that the elevated creatinine you might see with fenofibrate use isn't indicative of a decline in kidney filtration capacity or kidney damage. Instead, the kidneys are still functioning normally. They just have more creatinine to filter out of the blood because more is being produced. The clinical implications of this effect are quite significant. An increase in serum creatinine after starting fenofibrate could easily be misconstrued as the onset or worsening of kidney disease. This could potentially lead to the unnecessary discontinuation of a beneficial lipid-lowering therapy or prompt invasive kidney investigations. So, it's really important for healthcare providers to be aware that fenofibrate can cause a mild to moderate increase in creatinine typically within the first few months of therapy, and this increase then tends to stabilize. Monitoring strategies should involve recognizing this possibility and perhaps considering alternative markers of kidney function if there's any doubt. Fenofibrate's unique impact on creatinine production is definitely a key takeaway. Now, let's shift our focus back to antibiotics, specifically some intravenous forms that can interfere directly with how creatinine is measured. Number 5, Cefoxitin and Cefazolin, intravenous. Moving on to Cefoxitin and Cefazolin, specifically their intravenous forms. Cefoxitin and Cefazolin are cephalosporin antibiotics that are administered intravenously, and they're commonly used to treat a variety of serious bacterial infections. These particular antibiotics can cause a false elevation in serum creatinine levels, and this is due to interference with certain laboratory assays used to measure creatinine. This is a distinct mechanism compared to the drugs we've discussed that affect creatinine secretion or production. The issue primarily arises with older, less specific laboratory methods for measuring creatinine, particularly some versions of what's called the Jaffe reaction. In these assays, certain substances in the blood can react similarly to creatinine, leading to an artificially high reading. Intravenous cefoxitin and, to a lesser extent, cefazolin have been identified as these kinds of interfering substances. The false elevation is usually seen shortly after the antibiotic is administered and can be quite significant, potentially even mimicking acute kidney injury. Interestingly, this effect is typically associated with the intravenous forms of these cephalosporins and not with the oral ones. The timing of blood draws for creatinine measurement, relative to when the antibiotic was given, can also influence the degree of interference. For instance, if a blood sample is taken when the drug concentration is at its peak, the interference is more likely to be pronounced. Recognizing this assay interference is absolutely crucial for avoiding misdiagnosis and inappropriate clinical decisions, like altering antibiotic therapy unnecessarily or subjecting patients to further tests for kidney damage. Thankfully, modern laboratories are increasingly using more specific enzymatic assays for creatinine, which are less prone to this type of interference. Now, beyond these specific antibiotics, a broader range of substances, including certain vitamins and other less frequently used drugs, can also influence creatinine readings. Our final section in this list will cover these other notable mentions. Number 6, active vitamin D metabolites and other notable mentions. Finally, at number 6, we have active vitamin D metabolites and other notable mentions. Beyond the medications we've already discussed, several other substances can also impact serum creatinine levels, and it's good to be aware of them. Active vitamin D metabolites, like calcitriol, which are used to treat certain conditions related to calcium, phosphorus, and parathyroid hormone imbalances, can sometimes influence creatinine. While the exact mechanisms can vary, some studies suggest potential effects on muscle mass or metabolism, which could indirectly affect creatinine production. Then there are salicylates, a class of drugs that includes aspirin. In certain situations, particularly at high doses or in cases of overdose, these can affect kidney function and potentially creatinine levels. Though this is often linked to actual kidney effects rather than just interference. However, some older research did also point to assay interference with very high salicylate levels. Other less commonly used drugs have also been implicated. For example, pyrimethamine, an antiprotozoal medication, can, much like trimethoprim, inhibit the tubular secretion of creatinine. Furosemide, an older anticonvulsant, has also been reported to cause elevations. Now, while these drugs may not be as frequently encountered as, say, cimetidine or trimethoprim, their potential to alter creatinine levels really underscores a broader principle: a comprehensive medication history is always vital when interpreting lab results. Vigilance in both prescribing and interpreting tests is reinforced by understanding that a wide array of pharmaceutical agents can be responsible for unexpected changes in serum creatinine, often without indicating true kidney damage. So, that wraps up our top 6 list. Understanding these interactions is incredibly important because, as we'll discuss next, monitoring creatinine is a key part of assessing kidney health. Why monitoring creatinine matters. So, why is monitoring creatinine so important in the first place? Well, monitoring creatinine levels is truly a cornerstone of assessing kidney function. Creatinine, which is a waste product from muscle metabolism, is filtered out of your blood by healthy kidneys. When your kidneys aren't working efficiently, creatinine levels in the blood start to rise. This makes it an invaluable marker for detecting kidney disease, monitoring its progression, and also for adjusting medication dosages for drugs that are cleared by the kidneys. However, the risk of misdiagnosis due to these drug-induced creatinine elevations is a really significant concern. Think about it. If a rise in creatinine that's actually caused by a medication is mistaken for kidney damage, it can lead to a lot of unnecessary anxiety for the patient. It might also prompt further diagnostic tests, some of which can be invasive, or even lead to the inappropriate discontinuation of essential medications. On the flip side, attributing a true decline in kidney function to a medication effect could delay necessary treatment. This is why awareness of these drug interactions, for both patients and providers, is so crucial for accurate diagnosis and appropriate care. It ensures that kidney health is managed effectively and safely. But when you are faced with an elevated level, how do you figure out what's really going on? How to interpret elevated creatinine levels? This brings us to the important question: how should we interpret elevated creatinine levels? When you're faced with an elevated creatinine level, it's absolutely essential to distinguish between true renal impairment and a drug-induced elevation. The very first step is a thorough review of the patient's complete drug history. This includes over-the-counter medications, supplements, and any recent additions or dosage changes. It's particularly important to pay close attention to those medications we've discussed that are known to interfere with creatinine levels or their assays. Next, consider the timing of the creatinine elevation. Did it occur shortly after a new drug was started, or its dose was increased? A rise that happens soon after a medication change, especially without other signs of kidney disease, like changes in urine output, swelling, or new symptoms, might suggest a drug effect. Additional testing can also be really helpful. For instance, a cystatin C level is another marker of kidney function that is generally not affected by the same drug interferences as creatinine. Comparing trends in both creatinine and cystatin C can often provide a clearer picture. And don't forget, collaboration with laboratory professionals can be beneficial too, as they may be aware of specific assay interferences or can suggest alternative testing methods if interference is suspected. Best practices for clinicians and patients. Let's talk about some best practices for both clinicians and patients. To minimize the misinterpretation of creatinine levels, clinicians should diligently review a patient's complete medication list, and that includes any over-the-counter drugs and supplements, before interpreting lab results. When prescribing medications known to affect creatinine, it's really good practice to inform patients about this possibility. Also, timing blood draws appropriately, especially for drugs causing assay interference, can sometimes mitigate the issue. For example, drawing blood just before the next dose of an interfering antibiotic might yield a more accurate result. Now, for patients, it's incredibly helpful to maintain an updated list of all your medications and share it with every healthcare provider you see. Understanding that some medications can affect lab tests empowers you to ask informed questions. Really, open communication between clinicians and patients is key here. If a new medication is started and a subsequent lab test shows elevated creatinine, discussing the possibility of a drug-induced effect is a proactive step. This helps ensure accurate diagnosis and appropriate medical care and can prevent a lot of unnecessary worry and interventions. So, to wrap things up, understanding that certain medications can artificially elevate creatinine levels is absolutely vital. This knowledge helps prevent unnecessary concern for patients and helps avoid misguided medical interventions. Awareness, among both healthcare professionals and patients, coupled with careful interpretation of lab results in the context of a full medication history, is what ensures that individuals receive the most appropriate care, all while sidestepping the potential misdiagnosis of kidney disease. Did you find this information helpful? If so, please consider sharing it with your peers and loved ones to help spread awareness. You can also subscribe for more health insights, or feel free to leave a comment below with your experiences or any questions you might have. Together, we can improve patient safety and diagnostic accuracy.